On this episode of the ASC Podcast with John Goehle, we discuss the latest news, remind listeners about the CDC's recommendations about masking, and the CMS requirements for accommodations for unvaccinated exempt employees. And in our focus segment, we look into the importance of manufacturers' instructions for regulatory compliance.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers. Trivalence. Trivalence offers a comprehensive next-generation ASC solution that optimizes payment and supply chain performance, enabling actionable data insights. And Ambulatory Healthcare Strategies, the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to episode 180 of the ASC Podcast with John Goehle for February 18th, 2023, recording from our studios in Spencerport, New York. This is Sue Cronkite, Chief Researcher for the ASC Podcast with John Goehle and Operations Manager for Ambulatory Healthcare Strategies. We would like to remind our listeners that the ASC regulatory environment is a rapidly evolving landscape, and the material presented in this episode is based on the most current information available as of the date of the recording. As such, it is important to recognize that this information may be subject to change, and we advise all ASCs to stay up to date with the latest regulations and guidelines issued by their relevant regulatory bodies. And joining me is none other than John Goehle, the owner of Ambulatory Healthcare Strategies and one of the most respected experts in the ambulatory surgery industry. With over 30 years of experience, Mr. Goehle has authored over 10 books on the ASC industry and is a sought-after speaker on regulatory accreditation and finance issues. So he's got a big grin on his face.
So every once in a while we want to change the opening script here, and we used a one of these systems that creates a little bit more interesting dialogue here. So I did not write that, Sue.
That none other than John Goehle.
John Goehle. Yeah, we might have to change that a little bit. And Sue, we should point out that you have a new title with Ambulatory Healthcare Strategies. You used to be a senior nurse consultant. We're doing away with all that consulting terminology over at Ambulatory Healthcare Strategies, and everybody has a new title. But more importantly is you've moved up to Operations Manager for Ambulatory Healthcare Strategies. Congratulations. You're joining me in administration and trying to manage it's kind of like herding cats, isn't it? So manage our 20 employees and our 75 clients. So it's quite a job, and I don't know if you thought you would be working less hours. I know that's one of your ultimate goals, but that certainly is not happening. But welcome to the important job of managing the operations of the organization. So we have a lot of exciting news. The biggest thing is Rosie, who has been following us around all day, is in the studio here somewhere, but she's getting very close. She's
less than 2 weeks away.
Less than 2 weeks away.
March 1st, somewhere around there is when she's due, and we'll find out on the 24th of February. We're going to do have her get an x-ray, and we'll find out how many puppies are in there, but 8 or 9 probably.
Yeah.
She looks big.
She does look big. She looks very big. And, of course, we have been experiencing incredible growth over at Ambulatory Healthcare Strategies. One of the reasons that Sue had to move into a different role there is, that we've picked up, I'd say probably in the last 2 months, 10 new clients. So it's a pretty significant growth. So we apologize to our clients who are for clients that are trying to engage our services. There is a little bit of a delay right now on that, but we do appreciate everyone, and we're doing our best. And we have the same supply chain problems that everybody has in hiring people, getting them trained, et cetera. We have some exciting news. We are going to be introducing a new podcast, or a new edition. You might remember 2 years ago we introduced the staff edition. We're going to be having a staff edition probably in a couple days here, related to the very topic we have for our focus segment today. We're going to be introducing another edition called the Governing Body Edition. So there's been quite a bit of talk among our Patron members about how do we educate our governing body members on their responsibilities. And we were going to prepare like a 15-minute recorded segment on it that you could provide to your governing body like once a year. And then as we were thinking about it more, just having one recording is probably not enough. Maybe that's all you can get your governing body to listen to, but we just thought that it might not be a bad idea to have this edition available to any governing body members that would like to listen. It'll be short because we know their attention span can be a little bit short sometimes. They have so many other duties and responsibilities. And they could listen to it during a governing body meeting, or you could give them the link so that they could listen to it in their car. But our goal with that special governing body edition will be to focus on those responsibilities, those things that the governing body needs to know in very short segments so that it's easily digestible. And
we would ideally, and as you said, our goal would be for the staff edition to come out more frequently. I know we've kind of fallen behind. There's just been so much going on, but we'd like to get that out on a more regular basis, and the governing body one wouldn't be as frequent.
Probably every 3 months, maybe 4 times a year. But we're going to be working on that. The first one hopefully will be out in the next couple of weeks, and I hope that will go over as well as our staff edition has gone over with our audience. And
just been seeing some more news about that nurse transcript scheme that we've talked about a little bit, where some nurses.
I think it was in Florida, right? Or was it?
That's where the schools, which actually are not operating anymore, but that's where the people that were perpetrating it, I think, were based. But there were nurses from all over, and I don't know if I can really call them nurses, but people that some were LPNs, some did not have that education. But they bought some transcripts. I believe it was like $10,000 or $15,000 a piece that they paid for them to allow them to be able to take the NCLEX. And surprisingly,
they passed. Some of them passed.
Yeah, less than half, but still, it was pretty shocking to me. But I was just kind of following up to see what was going on. So some of the states, it doesn't sound like any are going to be charged, but many of the states are asking that the nurses voluntarily surrender their licenses, and most have not done that.
Oh, interesting.
I would think you would just want to get that done and apologize and hope you didn't get in more trouble. But maybe there's some sort of a legal reason they're trying not to do that. And some other states have just annulled the licenses. And there's been a lot of discussion on how this might impact the nursing shortage. And I've seen things. I'm not sure how long this has been going on, but they're saying some of these nurses may really have experience, and obviously they shouldn't be working as nurses, but it's one more blow to the
industry and
to the staffing.
Let's talk about some recent news, and some of this is really not so much news as just an update on things. There's been a lot of discussion about the mask mandate again, and we just want to remind everybody of the CDC requirements. And I'll put links in the show notes here to this information. But I know that I've gotten a lot of questions. We've had a lot of questions too during our Saturday drop-in patron sessions about the mask mandate because, of course, I think people are really so tired of having to wear a mask all the time. And the ongoing question that we're getting is, when is this going to be over? So the pertinent requirements are from the Centers for Disease Control, CDC, and it's from a recommendation dated September 23rd, 2023. And again, I'll provide both the link to these recommendations as well as the tracking link that helps you to find out where your particular county is with regard to the community transmission rate. So here is what those recommendations from September 23rd state. When SARS-CoV community transmission levels are high, source control is recommended for everyone in a healthcare setting when they are in areas of a healthcare facility where they would encounter patients. That would be, Sue, for example, the waiting, really almost every second section of a surgery center, except, the back office, et cetera. The healthcare provider could choose not to wear source control when they are in a well-defined area that is restricted from patient access, such as staff meeting rooms. And if they do not otherwise meet the criteria described in the following section, and community levels are also not also high. When community levels are high, source control is recommended for everyone.
And now when they say recommended, I just want to point out we've had people ask, well, they just suggest it. But it's a pretty strong recommendation when it comes from the CDC.
Well, I think Lori Roderick's in this morning's Patron thing made the point, well, the recommendations for hand hygiene are recommendations from the CDC also. But if you fail to do hand hygiene, of course, you're going to be cited for that during a survey. So surveyors would probably take the same approach here. The recommendations continue and say when SARS-CoV community transmission levels are not high, healthcare facilities could choose not to require universal source control. However, even if source control is not universally required, it remains recommended for individuals in a healthcare setting who have suspected or confirmed COVID-19 infection or other respiratory infections, such as a runny nose, cough, or sneeze, or have had close contact, and this would be for both patients and visitors, or a higher risk exposure, or if they are a patient or a visitor and have had close contact, or for a healthcare provider who has a higher risk exposure with someone with COVID infection for 10 days after their exposure, or reside or work on a unit or area of the facility experience a COVID-19 outbreak, which would not really apply to us, and have otherwise had source control recommended by public health authorities. In other words, if your local health authorities require it, you would be required to do that also. So again, at the present time, if you are in an area where the community transmission levels are high, and that is, I think it's 2/3 of the country still is at that category, you are still required to be wearing the masks. We'll provide a link to the way that you calculate or look for the community transmission rate. It is not always obvious, so you need to make sure that when you click on that link that I provide you, that you select the community transmission rate.
The transmission rather than just the level. And what many centers are doing is really watching for a sustained drop because it would just be so confusing and really almost inviting more arguments, I think, if you're changing it day to day. And every morning you're saying, okay, now you have to do this. And, it could really cause more problems than it solves.
And so I guess I should also point out, I've been all over the country in the last couple of weeks, and even when they're wearing masks, people are just not wearing them right now. And again, you have to kind of enforce that. So I don't want to be the bearer of this. Please don't shoot the messenger here, but this is indeed what the CDC is recommending. And we can't forget as we start to lift the mask mandates across the country that unvaccinated individuals who've been granted exemptions have to be treated differently than other employees. And this has to be documented in a letter to them that outlines the conditions of their accommodations when they were granted that exemption. So everybody that was granted an exemption, of course, they have to go through a process. They have to have approval. The approval needs to go all the way up through administration to the governing body. And then a letter would be issued to the employee with the specific accommodations they'll be expected to implement. And that letter should be signed by the employee indicating that they accept those accommodations. So remember that the requirements for vaccination or for employee vaccination comes under 416.51C, which is a standard for COVID-19 vaccination of staff. And this states that you have to have a policy to ensure that those staff who have been granted an exemption or accommodation as authorized by law who have a temporary delay adhere to additional precautions that are intended to mitigate the spread of COVID-19. And there's a variety of actions or job modifications a facility can implement to potentially reduce the risk of transmission, of COVID transmission, including but not limited to things like reassigning the staff to an area where they wouldn't be in touch with patients or in contact with patients, or to duties which limit exposure to those most at risk. Requiring staff to follow additional CDC recommended precautions such as adhering to universal source control and physical distancing measures in areas that are restricted from patient access, such as staff meeting rooms and the kitchen, even if the facility or service site is located in a county with low to moderate community transmission. And what this really means is that that employee has to wear a mask at all times and really can't be eating with other staff members. And then another accommodation, of course, is requiring at least weekly testing for exempted staff and staff who have not completed their primary vaccination series. That's really not applicable now until the regulatory requirement is met, regardless of whether the facility or service site is located in a county with low or moderate community transmission, or requiring that staff to use a approved N95 or its equivalent. And Sue, still I am running into centers who are not following the rules with regard to N95 masks. So I know you've heard it. You probably don't want to hear me state it again, but there's 3 main requirements if you have N95s. Number 1, they have to be fit tested to the exact model that they are wearing. Number 2, they have to have a medical evaluation performed at the time that fit testing is done. And 3, you have to have a respiratory protection program or set of policies and procedures for respiratory protection in your organization. And then you have to remember that as soon as you take the N95 mask off, you have to throw it out. If you are using the N95 in during a procedure in a procedure room or an operating room, you have to replace it after every procedure. So again, I thought it would be important to kind of reiterate some of those things that hopefully people haven't forgotten.
And I just saw this article in Becker's Hospital Review. A study looking at hospital board members found that less than 15% of board members overseeing the nation's top hospitals have a professional background in healthcare. More than half have a financial or business services background. Now, this was from a study whose authors are from Harvard Medical School, Brigham and Women's Hospital in Boston, and the University of Alabama at Birmingham. The study was limited as it represented mostly the high-ranking hospitals, and some hospitals don't report board information, so they did have limited information. The authors also mentioned a 2018 study which found that 42% of U.S. hospital boards had all-white members and 70% of the members were male. So
not a lot of diversity.
No, not a lot of diversity, and it just surprised me that so few had professional backgrounds in healthcare. Some had been in healthcare administration, but to actually have a clinical background.
Well, and what I find interesting about that too, Sue, is that compare that to the ambulatory surgery industry where that would be extraordinarily rare. I mean, all of our board members in our governing bodies are much more likely to be a physician or, the administrator of the organization, somebody that has a lot of experience. So that might explain why we have so many problems with hospitals understanding what we are.
And from Fierce Healthcare, January 24th, 2023, the Blue Cross Blue Shield Association, which represents 38 of the Blues plans, released several policy priorities for the current Congress as part of a new report. The name of the report is The Affordability Solutions for the Health of America, and they believe it will reduce healthcare costs by $767 billion over 10 years. Some of the policies would change Medicare reimbursement rates to pay the same amount to clinics, whether they are independent or affiliated with a hospital. And other parts of the plan would focus on prescription drugs and encouraging more participation in value-based care. But they have basically that site-neutral payment, I think could be a really great idea. And John, I don't think you'll like this comment. The American Hospital Association has argued that the outpatient departments need higher rates because they are beholden to greater regulatory standards than freestanding clinics. And I believe none other than John Goehle has said several times that doesn't really seem to be true.
That is so true. And again, it's probably because the people that have made these arguments don't have a healthcare background.
Yeah.
So indeed, those that have taken our courses, that listen to the podcast, that have gone through our boot camps know that indeed ambulatory surgery centers are subject to a much greater regulatory standard than the hospitals do. Of course, hospitals have other regulations they have to do. But when you're trying to make the argument, and it says, has argued that outpatient departments need higher rates because they're beholden to higher rate, that's just flat out wrong. I find it interesting though that $767 billion, that number actually seemed over 10 years seems kind of low to me, given that we know that you could save billions of dollars just by moving some of the more common cases to the ambulatory surgery setting. So, well, we'll see if anything happens with that. Certainly, we know we've got a major healthcare problem, affordability problem, and we have a great message if we could only get it across to the people that make these financial decisions. So let's talk about some recent experiences. Something that's been happening that we have to remind people. In New York a couple weeks ago, there was an injunction against the requirement for a COVID vaccination for facility staff, which stopped the New York State version of the COVID vaccination requirement. Now, I'm not quite sure where that is in the legal process here, but it started a conversation because people said, I don't have to have my staff vaccinated. We had to point out to our clients that asked that question that the CMS requirement is still there. So you made this note here that it's so important that we remember that there are a multitude of regulations that govern everything that we do in a surgery center. And even though the state requirement might be there, the federal requirement is going to be there. So remember that rule of thumb is always you always have to follow the most stringent regulation when you are trying to determine which regulations to follow.
Yeah. Same with the mask thing that we were just talking about, because in New York State, just all of a sudden it was all over the news that people didn't have to mask anymore, but
you still
have the
do. CDC,
and they don't mention that on the news. They don't, make that little footnote. So you really have to be aware of all of those things, whether it's, OSHA, whether it's NFPA, all of these different things. And I know sometimes our clients will ask us, well, where exactly did that regulation come from? And sometimes it's hard to remember and to figure out. You just know it's right, or it's the standard of care. But so, you just have to be careful.
That's right. And again, there's so many resources out there, and we try to keep you up to date on the podcast, of course, on all these regulations. But, I mean, this is going to sound like we're kind of pushing ambulatory healthcare strategies in the consulting wing here, but it is important to understand that you really have to keep on top of these, or read constantly. Becker's ASC, for example, the ASC Association newsletters and magazines, of course, our podcast, all of our conferences, attend regular conferences, attend your state association meetings to keep on top of this. And if you can't, or if you just don't have the time, and there are so many people that don't, you might want to consider, hiring a service such as what we offer. So, Sue, we have a great section on instructions for use, which is what we're going to talk about in our focus segment here. It's becoming such an important thing. We mentioned it a couple of weeks ago when we were talking about one of the centers that had been cited because they didn't have the IFUs for instruments they had. So let's take a short break, and we come back and we're going to focus on manufacturer's instructions and instructions for use. It's been a long day, and the surveyor has just left, and you are exhausted. And looking at the list of items that you have to address, you wonder, how can I deal with this and still take care of my patients? More importantly, you wonder, how can I ever keep up with all of the regulations, standards, and accreditation requirements? How can I always be prepared for a survey and reduce my stress levels? Well, that's what Ambulatory Healthcare Strategies does, day in, day out. We become your outsourced regulatory and accreditation resource. We can maintain your policy manual, develop your education programs, help out with fire and disaster drills, do your risk assessments, oversee your quality improvement activities, help run your quality improvement meetings and governing body meetings, and we can even prepare your monthly or quarterly financial statements and help you figure out where you are financially. We are a retainer-based service. We don't take ownership. We don't charge based on your revenue. We have one fixed monthly fee, and we can tailor your services to your exact needs. So whether you're looking for help getting over a survey, preparing for a survey, or looking for a long-term relationship to assist you with your ongoing regulatory and/or financial needs, please give us a call at 585-594-1167 or email us at info@ahstrategies.com. That is info@ah-strategies.com, or visit our website at ah-strategies.com. So in our focus segment, we're going to talk about the instructions for use. So to define instructions for use, or IFUs, they are written or pictorial information provided by a manufacturer or supplier of a medical device, medication, or equipment to guide the user in how to correctly and safely use a product. And they are crucial to the healthcare setting to ensure that healthcare providers, patients, or caregivers use the products appropriately to avoid harm or negative consequences. So the instructions for use typically include information on the indications, contraindications, warnings, precautions, storage, handling, assembly, operation, maintenance, and disposal of the product. And these are not just the safety data sheets, I should point out here. So they would include the safety data sheets, but that would only be one part of it. The IFU may also provide guidance on troubleshooting and emergency procedures in the case of a failure of the equipment. And in some cases, the IFU might also include technical specifications or guidelines for cleaning, sterilization, or disinfection of the product, which is, of course, is extremely important here.
Yes.
IFUs are important in the healthcare setting for several reasons. For example, safety. Medical products and equipment can cause harm or negative consequences if they're used improperly. Instructions for use provide critical information on the safe and correct use of a product, including any potential hazards, risks, or contraindications. And for compliance, IFUs are often required by regulatory bodies to ensure that medical products and equipment meet safety and efficacy standards.
And that's one thing to mention, that you should be able to find those and show them to somebody if they ask, even if you feel like you know it, you've always, you've half memorized it. You have to be able to locate those.
Or if you've had the equipment for 20 years, it doesn't matter. You still got to have it. Liability. In the case of adverse events or injuries related to the use of a product, healthcare providers may need to demonstrate that they follow the instructions for use to avoid any liability. And from the quality standpoint, IFUs can help healthcare providers ensure that the products are used consistently and correctly, which can improve the quality of care and patient outcomes. So speaking as a surveyor, I will tell you that that is like 1 out of every 10 words that we say or questions that we ask of people during a survey is, can you show me the instructions for use? Do you have the instructions for use?
So if they ask you a question, you're stumped, just say instructions for use. That's
right.
Usually the answer.
Just make sure you can find them. I've actually started doing this based upon what happened in one of our surveys. I did a survey a couple weeks ago where I just picked an instrument on the shelf at a center that I was surveying and said, "Find me the instructions for use." And to his credit, the guy that was doing this, he said, "No problem." I mean, he didn't even flinch. He said, "No problem, I'll be right back." And I said, "Stop." I said, you clearly know exactly where it is. We have limited time during the survey, but he didn't even flinch. Now, if he had hesitated for a second or did not seem like he knew what I was asking for, I would have certainly carried through on that. So, and then we also want to make sure that you're actually using them. I like a really worn copy of that instructions for use. If you're, we're going to go through all the different regulatory issues on them, but for example, for wave testing, if you use a device for blood glucose, that instruction for use should be immediately available right next to the machine. And have highlighted in there using the highlighter those important things that people need to know about it. And of course, the staff needs to know exactly where those IFUs are at all times. And you'd have to have them available for everything that you use, literally every piece of equipment, every supply that you use in your organization. So let's start by going through. So what I did is I went through all the conditions for coverage here and searched for references to manufacturer's instructions. And I use that as kind of a basis for, especially when you want to have the regulatory basis, it's always good to go back to the conditions for coverage. So let's start with pharmaceuticals. And the regulatory section for this is 41648A, which is the standard for administration of drugs. And this states that drugs must be prepared and administered according to established policies and acceptable standards of practice. So, Sue, why don't you tell us the interpretive guidelines for this section?
Okay, the ASC must have policies and procedures designed to promote medication administration consistent with acceptable standards of practice. The policies and procedures should address issues including but not limited to following the manufacturer's label, including sorting drugs and biologicals as directed, disposing of expired medications in a timely manner, using single-dose vials of medication for one ASC patient only.
So again, very specifically right in the interpretive guidelines there, it talks about the manufacturer's. It says in this case the manufacturer's label, but of course that also refers to the instructions. Moving on to equipment, we're often asked what are the requirements for regular maintenance and inspections of all of your equipment. So they'll ask us, okay, what should we be doing with our generator? And the simple answer to that is, of course, that you need to read your instruction manual. So I remember you had a client, and I had a client that had a generator that was over 50 years old. They did not have a copy of the instruction manual, and of course the surveyor during a survey asked for it. They ended up having to have they couldn't replace it, so they ended up having the company that maintains the generator create an instruction manual for that. That outlined all the care for that equipment, which is the best they can do, and that was acceptable in this case. Remember to have all of the instruction manuals close to the equipment, and remember, if you're using an electronic version, How are you going to access it during a power outage? And this, of course, is particularly important in the case of a generator where if the generator is running, it probably means that you don't have access to a computer with that information that should be there. So, again, if you want to know what the maintenance schedule is for all of your equipment, and that would include your emergency lights, your backup lights, your exit signs, all of those would be dictated by the instructions for use. Let's move on to alcohol-based skin preparation, and this falls under 416.42, the condition for coverage for surgical services. And just to remind you of what that condition states, surgical procedures must be performed in a safe manner by qualified physicians who have been granted clinical privileges by the governing body of the ASC in accordance with approved policies and procedures. And even though that doesn't really sound like it would be referring specifically to instructions for use here, it does say must be performed in a safe manner. So the Interpretive Guidelines for 1642 state,
the use of an alcohol-based skin preparation in ASCs is not considered safe unless appropriate fire risk reduction measures are taken, preferably as part of a systematic approach by the ASC to prevent surgery-related fires. A review of the recommendations produced by various expert organizations concerning use of alcohol-based skin preparations in anesthetizing locations indicates there is general consensus that the following fire risk reduction measures are appropriate. Using skin preparation solutions that are 1, packaged to ensure controlled delivery to the patient in unit dose applicators, swabs, or other similar applicators, and 2, provide clear and explicit manufacturer-supplier instructions and warnings. These instructions for use should be carefully followed.
Okay, and again, I was just trying to show some examples in the regulations that specifically reference this. And, of course, our alcohol-based hand rubs, that falls under 416.44b, which is safety from fire. And this states an ASC may place alcohol-based hand rub dispensers in the facility if the dispensers are installed in a manner that adequately protects against inappropriate access. And, of course, then the Interpretive Guidelines go on to talk about that. Regular maintenance of ABHR dispensers is seen as a crucial step in making sure that its dispensers do not leak contents and thus cause a fire. ASCs are expected to maintain these dispensers in accordance with manufacturer's guidelines. If a manufacturer does not have specific maintenance requirements, the facility is expected to develop its own policies and procedures to maintain all ABHR dispensers. And Sue, this is one of those areas that I've been having some problems with recently because people, they're just so used to using these alcohol-based hand rubs that they don't look at these instructions, and especially for those dispensers that automatically dispense it, they have to be maintained. They have to be tested periodically, and they need to be cleaned periodically, et cetera. And people don't even know that those requirements are there, or replacing batteries is another common problem. Probably one of my least favorite things to talk about, but one of the most common things we talk about is temperature and humidity. And that falls under 416.44a, the standard for physical environment. And this states that the ASC must provide a functional and sanitary environment for the provision of surgical services, and each operating room must be designed and equipped so that the types of surgery conducted can be performed in a manner that protects the lives and that assures the physical safety of all individuals. And again, the interpretive guidelines here for 416.44a1 are very important because this is where they talk about the 20 to 60% relative humidity, but there is an important codicil here. So let's listen to what it states. Addendum D of the ASHRAE standard requires relative humidity in ORs to be maintained at between 20 and 60%. However, ASCs must consider sterile supply and medical equipment manufacturers' instructions for use regarding required humidity levels prior to any humidity level adjustments, such as to 20 to 60. Failure to maintain the manufacturer-required humidity levels may void sterile packaging and result in medical equipment malfunction or failure, and, of course, would also result in a citation from an organization.
Yeah, so although you can follow their recommendations for the humidity and the temperature, you have to first make sure that everything you have in that can be exposed to that is not compromised by, the levels you've decided to set.
And it just is general practice that 30 to 60% meets virtually every piece of equipment that's out there. Let's talk about sterile processing and high-level disinfection. We've talked about this quite a bit on the podcast. I don't want to spend a lot of time reiterating, but I do want to reiterate the important factors here. You need to have the instructions for use, the manufacturer's instructions for every single piece of equipment, for every single instrument that you have. there. You need to be able to identify who the manufacturer is for each of those instruments.
And just a quick point, because a lot of times you have salespeople coming in or the reps or people that are repairing it. They tell you, like, say, for this humidity, they say, oh, this is fine at 20. You have to get that in writing. You can't just take their word for it. You have to, and they probably aren't going to amend what their instructions for use are, but you can't follow something that isn't in writing.
Yeah, and actually, I'll give you a good example of that for a supply, Sue. There's a viscoelastic that is stored in a refrigerator. I'm not going to mention the brand name, but it has an arrow on it that states that, and it's stored in the refrigerator, it has to be stored in an upright position. And often I'll go into a center and they'll be on its side. And I'll say, no, that I need to follow the manufacturer's instructions right there in the box. And they'll say, oh, don't worry about it. The rep told me that it's okay. I said, did he put it in writing? Can I see that letter that says that? And of course, there is no such thing. So every single piece of equipment, every single instrument that's used in your sterile processing and high-level disinfection needs to have an IFU. We will be asking for it during a survey. We're going to be relying upon that information when we're, observing the individuals working in that area, making sure that everybody follows those instructions for use to the T, including, measuring the appropriate amount of disinfectant as part of that cleaning process. I did want to point out, this is not something you put into policy. A policy would say that you would follow the manufacturer's instructions, not what those manufacturer's instructions are. Otherwise, you're likely to have to keep revising those every time you get a new product.
And I think sometimes to show what you're doing, people either, if you're talking about a soak in a sink, you might mark the sink with the different levels. And also, if it's something like a dry time or a soak time, make sure there's a clock or some means of that you can prove that you actually know how long something is.
It's so funny you should say that, because I just picked up online for like $2 4 timers. We use them here on the podcast for our conferences so that we can time. So when Lori starts to talk too long, because of course I never talk too long.
Never.
We have those beeps coming in. So I picked them up for $2. I mean, these things are not expensive and they're very easy to buy. Put them all over the place so that you can do proper timing. CLIA wave testing, mentioned that earlier, but let me just reiterate that you need to make sure. So one thing to do is make sure that the manufacturer's instructions indicate that something like your blood glucose is approved for use on multiple patients and that it is approved for a CLIA waiver. And then, of course, make sure that there's competencies performed on each of your employees and that they follow those instructions. Make sure that those instructions for use that's one of those instructions that you can't have electronically. It's got to be really right next to whatever test you're performing, and then highlight, as I mentioned, the pertinent sections there. And again, for any other wave testing that you might have, make sure that everybody has been appropriately trained. And anytime you get a new product, and that happens quite a bit for things like urine pregnancy, for example, you're going to have to get the new instructions for use. So.
Yep, and always make sure it's for multiple patients.
So just to kind of conclude, instructions for use are crucial in the healthcare setting to ensure the safe, effective, and appropriate use of medical products and equipment. They provide critical information to healthcare providers, patients, and caregivers, and help ensure compliance with the regulatory standards and quality of care. And definitely something that your surveyors are going to be looking for. So let's take a short break, and then when we come back, we'll talk about upcoming events in the ASC industry.
In this segment, we provide an update on upcoming topics for the podcast, our upcoming virtual conferences, and upcoming speaking engagements for John and his staff and other events in the ASC industry.
So the Georgia Society of Ambulatory Surgery Centers and the South Carolina Ambulatory Surgery Center Association are holding their semi-annual conference and trade show March 30th to 31st at the Renaissance Atlanta Waverly Hotel.
And AORN's Global Surgical Conference and Expo 2023 is going to be held April 1st through the 4th at the Henry B. Gonzalez Convention Center in San Antonio, Texas.
And the ASCA 2023 Conference and Expo is May 17th through the 20th, 2023 at the Kentucky International Convention Center in Louisville, Kentucky. And Sue, you just signed up 12 of our employees there, right? I'll be speaking there, and we're very excited about that. It's and we'll be doing a podcast, at least one podcast, probably a couple. And if you are a listener, We'll provide some information on how you get in touch with us during the conference, or send an email to info@ASC Podcast, and maybe you can be on one of those episodes.
And the Arizona Ambulatory Surgery Centers Association's annual conference and exhibits is June 22nd and 23rd, 2023 at the JW Marriott Camelback Inn Resort and Spa in Scottsdale, Arizona.
And the Florida Society of Ambulatory Surgical Centers annual conference and trade show is July 19th through 21st, 2023 at the Loews Portofino Bay Hotel Universal in Orlando. And we do want to remind everybody of our upcoming boot camps. The May Director of Nursing Boot Camp is coming up, and it's advertised on our website at ascpodcast.com. The July Administrators Boot Camp is also there, and we will be introducing our brand new boot camp, which will be in August, the Business Office Manager Boot Camp, and that's actually going to start August 8th. Also, don't forget about all of our recorded events, which are all available at ascpodcast.com. We have our credentialing conference that was recorded in 2020, but it's still relevant, of course. We have the Fall 2022 Finance and Accounting Conference, the Conditions for Coverage Conference, which is a full-day conference that goes for all the conditions for coverage. The Medical Director Conference, which is like a 6-hour conference for medical directors on what their responsibilities are. And we do have on-demand versions of the Director of Nursing and Administrators boot camps. And again, all of those are available at ascpodcast.com. We do want to remind everyone to become a patron member of the podcast. The Patron Member Program, which is also known as ASC Central, is an exclusive membership website that provides a one-stop ASC regulatory and accreditation compliance, operations, and financial management resource for busy administrators, nurse managers, and business office managers. And the resources include some of our virtual conferences, links, policies and procedures, forms, drills, and various discounts. And patron members are able to visit with us on Saturday mornings. Not always on Saturday mornings, but that's our regular time at 10 o'clock Eastern Standing Time. We had a lot of people on today. It was well over one of our bigger sessions. And we always get a lot of advice. So when we were getting ready for today, we weren't quite sure what we were going to talk about. So somebody mentioned
for ideas.
and said instructions for use. So that's why we're talking about it. Membership helps to defray the costs of producing the podcast, including our research staff, travel costs to conferences, equipment costs, and production costs. And for more information, you can visit ascpodcast.com. So thank you for tuning in to this episode of the ASC Podcast with John Goehle. We hope you found this discussion informative and engaging. And if you did, we encourage you to share it with your friends and colleagues in the ASC industry. And don't forget to hit that subscribe button so you never miss one of our episodes. We'd like to give a special shout out to our amazing team who make this podcast possible. Our sound editor, Susan Cronkite, our executive producer, I guess that would be me, John Goehle, and our dedicated research team of Jenna Alvarez, Judy D'Ambrosio, Alex Borneman, Zach Galeritis, Amy Durbano, Lori Rodericks, Kathy Foti, Donna Macchio, Ann Geyer, and Diana Powell. We couldn't do it without them. Our music is provided by Media Sushi and Mike Noah, and the ASC Podcast with John Goehle is hosted on Podbean and is available on all major podcast platforms. We look forward to bringing you more exciting discussions and insights in the future episodes. Thanks so much for listening.
This episode of the ASC Podcast with John Goehle is sponsored by Surgical Information Systems, Trivalence, and Ambulatory Healthcare Strategies. Surgical Information Systems provides cutting-edge information solutions for surgery providers. Trivalence offers a comprehensive next-generation ASC solution that optimizes payment and supply chain performance, enabling actionable insights. Ambulatory Healthcare Strategies is the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute, legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you are interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.